There are various ways in which transvaginal sonography has an edge over transabdominal scan. In a transabdominal ultrasonography, where we do the USG from abdomen, we need a full bladder, without which we cannot visualize the pelvic organs. But in a TVS, we do it with an empty bladder. Secondly, in transabdominal scan, when the patient has a lot of fat, lower abdominal fat, the ultrasonographic window gets very poor and we cannot have a good resolution of the organs visualized. But TVS cut shorts that limitation and we can get a direct access to get a very crisp and accurate picture of the organs. Thirdly, transvaginal sonography is involving only sound waves and does not involve any ionizing radiation, unlike X-ray or CT scan. The cost is also much lesser than an MRI, where we have to pay a lot more to get a good imaging diagnosis. Transvaginal sonography again is done very quickly and it is a painless procedure. There are various misconceptions regarding transvaginal sonography. The patients feel since the probe is inserted from one patient to the other, there will be a cross infection, but that actually does not happen. We use a probe cover on the transvaginal probe before we introduce it. So the second misconception is that people believe that transvaginal sonography can induce abortion if done in pregnancy. But that is also not true. Obstetricians do advise TVS for pregnant patients, and there are several indications like diagnosis of a very early pregnancy sac in a pregnant mother to locate whether it is inside the uterus or it is implanted outside the uterus, which we call very commonly as an ectopic pregnancy. Thirdly, transvaginal sonography is also indicated in infertility evaluation, where we have to see the fallopian tube otherwise via laparoscopy. TVS is a much simpler and easier alternative where we can instill a little bit of saline into the uterine cavity and see whether the fluid is passing through the tube and having a spillage. So that way we can avoid doing a more invasive laparoscopy involving hospitalization, antenatal anesthesia, etc. So we are now able to understand that TVS has its own indications in obstetric and gynecological practice. So I would discuss with you on this point and request you to overcome all the negative feelings towards TVS and take advantage of doing this procedure to reach a beautiful imaging and also to reach a conclusive and more precise diagnosis in any gynecological conditions like excessive bleeding or delayed periods or any kind of cystic ovaries or somewhere where there are uterine tumors or insertion of intrauterine contraceptive device where we want to locate it, postmenopausal bleeding, and there are numerous indications for this. So please contact our Institute of Fetal Medicine desk for any queries or appointments and go ahead with the scan if you are asked by your gynecologist to do it. Thank you very much.